Thing is, make sure that your patient is always comfortable. If it means giving them a pillow underneath their head, you give them a pillow. Make sure they're elevated, because that always takes pressure off of the lower back so they feel comfortable, all right? All right, so basically, people, this is the cranium in here, right, up in here. This is all the facial bones, all right? So this would be your frontal, right? And if we go back, let's see where right here is where his suture is, his coronal suture, all right, or frontal suture. So, and then right back here is his parietal, sagittal suture. So, on either side then is your parietal bones, okay? Just above the ears in here is your temporal bone, okay? And this here would be your zygomatic arch, which is really part of the temporal bone, all right? Now, open your mouth. All right, you'll feel the condyle of the mandible right here, okay? All right, so let's continue with the cranium. All right, so we did the prayer. Right around here would be those greater wings of the sphenoid that you would have, I showed to you, all right? And then can you just lift your head? In the back, right here would be your occipital bone, okay? And he had a very good mommy because his EOP is very small,
Can I
okay?
touch?
Yeah, you may touch.
Yeah.
Yeah. Oh, and if you want to touch mine, you're more than welcome. It's huge because my mother left me on my stomach all the time. Maybe that's why I have so much GI distress right now.
Oh, okay.
You know?
有个洞，
And then along the side, you feel the
为
ridges.
什么他说那个洞是有个洞吗？
Yeah, it's good. It's
我也不
good.
知道。
为什么要小？
I'm just saying that. All right. Okay, people. So now let's go through some of the other bones. All right. So this here would be his zygomatic bone, the cheekbone, right? Okay. This here was his mandible. As I said, this would be his TMJ. Would be right there. Where are you? There it is, right there. Okay. All right. And when the TMJ is out, sometimes you'll hear clicking. Sometimes, I have this one patient lately that's been. She says the pain is here. The pain is here, but this is the side that is contracting and is really back into the condyle of the TMJ, because it's so tight. It literally pulls the other condyle out of the socket a little bit, so that's very stressful and painful. Now, if you go, this is your ramus of the jaw right here. Okay, so here's the body of the jaw. Here would be the ramus right here coming up here. This is the angle of the jaw. If you go in on an angle just about here, that's your stomach 6. Okay, so if you have a TMJ problem, the 6, 7, where is it? Right here, right there. 7, stomach 6, and then gallbladder 2. Or you could do that, or you could also do small intestine, what is it, 20, 21, and then 19 for, no, small intestine 19, and it's Sanjiao 21. For some reason, I keep thinking my old professor that taught me, she calls it the 3 cows. I don't know where she got that from, but I don't know if there's some sort of Chinese proverb that talks about 3 cows and it's in the mouth. I have no clue. But anyhow. All right, so now the masseter muscle is right here. So that helps to, all right, that helps to elevate the jaw, right? Underneath here, underneath the jaw would be your medial pterygoid, okay? That helps with protraction and helps with deviation and elevation, okay? All right, so let's go back to the muscles. I'm getting all crazy here. All right, so right in here is your 2 nasal muscles right here, okay? Bones, excuse me. We had this for the zygomatic bone. We have, the foramen mente should be right in there, okay? All right, and then right underneath here is your orbit, your what do they call it? Infraorbital fossa.
Oh,
Okay, stomach 2. All right. So on either side of the nose and down here, this upper part of the jaw is the maxilla. Okay, you have 2 of them. All right. You have the maxilla palatine, which I showed you, and behind it is the palatine bone. All right. Now you can't see it, but in your diagrams, you're going to see one small bone with a hole in it. That's your lacrimal bone, right in the corner of your eye. And behind it, then on either side, you'll see the ethmoid. Okay, so it's behind. Remember that. Okay. What other bone do I have to do? Oh, the vomer, you can't see. It's the septum of the nose right here, and on either side are your conchae. Okay. All right. I think we got more or less all of them. What I want to go through, which we didn't go through in the lecture, is the different markings of the neck area. So first off, if you come underneath the jaw, let the others see it too, please. I don't mind you taking pictures, but don't obstruct the view. All right, right here. Now swallow, sir. Just swallow. Swallow. All right, and you'll feel the hyoid bone coming down. All right, the hyoid bone attaches the tongue to it. All right. Now the hyoid bone is at. Now I'm going to give you levels, and I expect you to know them too for different processes and stuff. There is at the hyoid bone is at cervical vertebra number 3. So C3 is the level of the hyoid bone. If you were to go behind, okay. Then you have here is the beginning of his thyroid cartilage. See, with men, they have bigger Adam's apples than women, okay? It's very hard to palpate it on a woman, all right? But that goes from C3, or cervical vertebra 4 to 5, okay? That's the thyroid cartilage. And then if you come down, you'll feel here a ring of cartilage, which is the cricoid cartilage. Okay, and that's C6, cervical vertebra 6. All right? Okay. Now let's just do the triangles first, and then I'll go into some of the muscles. All right? No. I'll tell you when. All right. And people, if I see you palpating too hard, I'm going to go over and swatch it. All right? Because you got to learn the proper pressure, because people won't want to come back and see you if you're going to cause them pain. All right? And again, if you are going too hard, look at their feet. They're going to be flapping, or their hands are going to be going because they're not feeling comfortable. All right? You ask them, and throughout the whenever you touch them, continually ask them, "Are you okay? Have I been too hard on you?" If you say yes, I'll hit you. Have I been too hard on you?
No.
Okay, that's what I wanted to hear. All right. So then, okay. So we have the anterior cervical triangle. So this is his midline. Okay. This here is your jugular notch, people.
Yes.
All right. So here's your midline. All right. So if you can turn your, this is his SCM. Right here, okay? So, superior border, front anterior border, and lateral border, okay? Anterior border of the SCM, where the median line is, and the inferior border of the mandible, all right? Okay, what's in there? Chi. All right, what's chi? What does C stand for?
C is
Common carotid, yes, go ahead. H, it's a nerve, cranial nerve.
hypoglossal nerve.
Yeah, hypoglossal cranial nerve. And the hypoglossal nerve helps to innervate the tongue area. All right, and then what else?
Internal jugular.
Very good, you read so well. Okay, so as I said, so this would be the level for stomach 9. Okay, this would be large intestine 18 between the two bellies. This would be Sanjiao 16, excuse me, 16. All right, so, and in order for you to find stomach 10, you go from up here, and then where right in here, which is stomach 11, and midway between, that's where it is. Okay, so now, all right. So if we turn his head again, all right. Do you see that little triangle right there? So that's your lesser supraclavicular triangle. Internal jugular vein is there. Stomach 11 is there. All right, people? All right, so that's that. So that's all of the anterior cervical triangle. All right, so now if we go this way, we're going to do the posterior cervical. First of all right, this here, I said the lesser supraclavicular triangle. Triangle. No, it's fossa. It's a fossa. All right, this is your greater supraclavicular fossa right here. See that depression right in here? That's what that is, okay? It's very superficial. All right, then you have, so here's your SCM, and if you gently press in here, this is his trapezius, right in here. So this is the posterior border. This is your inferior border, the clavicle, and then this is your SCM, the posterior border of the SCM. What's inside? Base. What's base?
Brachioplexus.
Go ahead.
Accessory cranial nerve.
Accessory spinal nerve, subclavian, and external jugular. And on him, you can't really. Oh, here. Well, this here is like his external jugular, right there. So sometimes they're really big. Okay. All right. Now, up in this area here would be your splenius capitis on the floor of that triangle, and then down here would be your levator scapula. All right. So now down in here again, if we were to draw a line like this, that's your omohyoid triangle. This is your omohyoid muscle, and this is your omohyoid triangle. In there is the subclavian artery is in here. If you go down deep, sometimes you can feel it. I can't feel it right now, okay? But you go down deep there. So basically what I'm trying to tell you is be careful, because this is the subclavian artery. It's a large blood vessel, okay? Then you have, underneath that omohyoid, you have the anterior scalenus, and then just behind it you have the posterior, the medial scalenus. In between this thin area here is your brachial plexus, okay? Now there was, I don't know if they still use this terminology, but there was a disorder called the scalenus anticus syndrome, where you have these two scalenus muscles clamping down on the brachial plexus, causing either pain or paresthesias, which is like bugs crawling, or